I'd like to invite you to sit back and relax. I'm going to share with you to open this training on professional risk communication. I'm going to share with you an article that was written in the New York Times. I'm just going to read pieces of it in order to share a story with you. The article is entitled, How to Tell a Mother Her Child is Dead by Naomi Rosenberg. Philadelphia. First, get your coat. I don't care if you don't remember where you left it. You find it. You put on your coat and you go into the bathroom. You look in the mirror and you say it. You use the mother's name and you use her child's name. You may not adjust this part in any way. I will show you. If it were my mother, you would say, Mrs. Rosenberg, I have terrible, terrible news. Naomi died today. You say it out loud until you can say it clearly and loudly. How loudly? Loudly enough. If it takes you fewer than 5 tries, you are rushing it and you will not do it right. You take your time. After the bathroom, you do nothing before you go to her. You do not make a phone call. You do not talk to the medical student. You do not put in an order. You never make her wait. She is his mother. When you get inside the room, you will know who the mother is. Yes, I'm very sure. Shake her hand and tell her who you are. You never stand. If there are no seats, the couches have arms on them. You will have to make a decision about whether you will ask what she already knows. If you were the one to call her and tell her her son had been shot, then you have already done part of it. But if you have not done it yet, you are about to do it now. You never make her wait. She is his mother. Now you explode the world. Yes, you have to. You say something like, Mrs. Booker, I have terrible, terrible news. Ernest died today. Then you wait. You will not stand up. You may leave yourself in the heaviness of your breath or the racing of your pulse, but you will not stand up. You are here for her. She is his mother. If the mother has another son with her and he has punched the wall or broken the chair, do not be worried. Security is already outside the room, and when they hear the first loud noise, they will know to come in. You do not have to tell them. They will be kind. If she asks, you tell her what you know. You do not lie. Before you leave, you break her heart one more time. No, I'm so sorry, but you cannot see him. There are strict rules when a person dies this way. You want to tell her that you know that he was hers, but she knows that and does not need for you to tell her. Instead, you tell her that you will give her time and come back in case she has questions. More questions or questions for the first time. If she has no questions, you do not give her answers for the questions she has not asked. When you leave the room, do not yell at the medical student who has a question. When you get home, do not yell at your husband. If he has left his socks on the floor again today, it is all right. In case you want to find the article again, that was a publication in the New York Times, How to Tell a Mother Her Child is Dead. This is a training on risk communication. The goal of risk communication is to enable informed decision making. 3 values we have at Brilliant Birth Academy are similar to the values written in the Declaration of Independence. Life, liberty, and the pursuit of happiness is what our founding fathers said was inalienable human rights. And we have altered that a little bit to include a value of life, of liberty, or informed consent. And informed consent is something that most medical professionals have training in, and is something that the American natural birth movement has lots of room to grow in. So this course will give you the guiding principles you need to master medical risk communication training, risk communication at a professional level. Interacting with parents who have unique and oftentimes serious concerns requires more than just presenting the correct information. How you present or frame the information and the impression that you give matters too. People who know the facts may still not fully understand what they could mean for their future, and they struggle to imagine different possible futures. So, we are going to learn how to improve our communication without sacrificing scientific accuracy. We're going to learn how to answer common questions, and we're going to learn what to do when you don't know the answer to a parent's question. So, this course will essentially present the types of facts that matters and how to convey those professionally. I want to just start off by giving an illustration. Let's say that you were in a convoy where you had a limited number of seats and you were driving across Death Valley or the Sahara Desert, and you were on some type of an important mission. And one of the people that you had in your team in this convoy was a professional mechanic, and he was there to ensure that your convoy got from one edge of Death Valley to the other side, and was there to make any mechanical repairs to equipment, including the car and tracking devices. And that was why he was in that seat, taking up a seat, right? He isn't there because he was a friend or because he was any other part of the mission. His job was to get you from one side of the valley to the other alive. Now, imagine if you are driving and this, person who was supposed to be the mechanic, you start to smell antifreeze, and you were to say to them, "Hey, do you smell that? It looks like with the dials, like the, the tank here might be overheating, and I'm smelling antifreeze." And he goes, "Oh, well, here, I brought some essential oils. Maybe let's do some essential oils. Do you have any particular mood that you want to be in right now? Maybe some peace to help you just clarify and calm your senses. Or I could put on a soundtrack. I've developed several soundtracks for this occasion." And you're like, "No, I want you to get out of the car and look under the hood." And he goes, "Well, every time you do that, it really just injects like a spirit of fear into the whole experience. So, I really think we just need to trust this tank. I think we need to trust the tank, just trust that it was designed to do what it needs to do. And maybe let's, I have several, maybe positive declaration statements that we could make together." And you're like, "No, like you are in the seat because you're supposed to be the person who helps if something mechanically goes wrong. Like, I need you to check and make sure, I need you to be thinking about what could possibly go wrong. And it's my job to enjoy the road trip. It's my job to put together the playlist and to assume everything will be fine. Like, I'm the one who's supposed to be having peace of mind. You're supposed to be the one who's thinking about all the problems preventatively and then troubleshooting and fixing them, right?" And if that mechanic doesn't believe that that's their job, right? If they actually don't want the job of mechanic, if they're trying to be the best friend in the scenario or whatever on the road trip, then you have a lack of clear expectations and a lack of professionalism. And unfortunately, a lot of professionals fail to grasp why it is that the parent is paying them and how to partner with the parent. It is your job to give the parent the gift of clarity, of peace of mind, of a good experience, of knowing what all the possible outcomes could be, and helping them to understand how to make choices that are in alignment with their values. It is not your job to, quote, trust the process or to assume that everything is going to turn out. It is your job to actively scan the scenario that's unfolding for all the possible things that could possibly go wrong. And if it seems as though something is developing in a direction where it could potentially threaten the outcome that the parents are hoping for, to communicate that to them clearly, professionally, and in a way that helps them to make the best decision, and to not withhold that information until you have a real crisis that has developed. So let's look into how to do this well. So like we said, the goal of risk communication is to enable the parents to make informed decision. It helps parents decide what they want given what they might be able to have. So we're going to introduce conceptual framework for thinking about risks, and by viewing them in the context of some birth and placental decisions where they might matter. So this book, Risk, A Very Short Introduction, is where I gleaned a lot of this material from. And they ask the question, what is risk? Risk entails some chance of losing something of value. If people value different outcomes, then they define risk differently. As a result, defining risk is an exercise in value-focused thinking. It can be informed by reflecting on which outcomes really matter. So as this presentation will explain, parents can make different choices based on the same information if they have different values. And part of your job as a professional is to communicate facts clearly, to leave space for the parents to have a conversation about their values, and then to help determine what's the right course of action for them. So risk threatens things that we value. What we do about risk depends on the opinions that we have, the outcomes that we value, and our beliefs about what outcomes might follow if we choose each option. So what we do about risk depends on the options we have. Risk is influenced by the outcomes that we value, and it touches our beliefs about the outcomes that might follow if we choose each option. That's something as a professional you are responsible for, is how you shape the parents' understanding of the likelihood of the outcomes. And so how you frame things, we understand matter. If you frame, like a hospital would, a GBS test as this is routine testing and we do it because if the GBS infection that is likely in your vaginal canal infects the infant, and if they develop if they develop an infection, they could die. You could come into their bedroom on their second day of life and they could be in the crib dead with no warning. That is a very different presentation than a huge percentage of women have this bacteria naturally occurring in their vaginal canal. Most people in my midwifery practice don't test for this. If you test positive for this, we're not going to be able to have the home birth you imagined, and you're going to have a antibacterial an antibiotic IV during the birth. And so you choosing to do this test that doesn't really give very relevant information is going to mean that all of your plans go out the window, right? And then when that mother's baby dies at 2 days old, she all of a sudden is like, wow, I don't feel like information was framed for me in a way where I really understood the risk decision that I was making. And she goes and she says to medical professionals, was this like an anomaly? Did you know that GBS could do this? And they're like, oh, yes, of course. GBS kills a very small percentage of children. But right, like risk matters differently when all of a sudden you're the 0.001%. And part of communicating and framing decisions, right? People tend to make decisions based on whether or not they're framed as, well, this is what everybody does. If a hospital says, well, GBS testing is what everybody does, or if a home birth midwife says, well, opting out of GBS is what everybody does, and here, like, this is just the routine form to, like, opt out of it, this is what everybody does, it tends to change informed consent. And the goal of professional risk training is to help parents to make choices. And sometimes those choices are simple, such as deciding to encapsulate. And part of your job as a professional is to get the parents to communicate their values, to frame the decisions in a way that gives them all the information they could possibly need in order to make decisions that are most in line with their values, so that they would never come back and say, after, an undesirable outcome, wow, if you had like communicated to me that this was a possibility, I would have not made this decision, right? So as a medical professional, the impression that you give, the framing that you give matters. And what you don't want to have happen is to really not talk about the negativity with the parents, hoping that everything will just kind of go smoothly. And then for the parents to come back and say, wow, did you know that this was an option? And for you to say, yeah, but I mean, it was such a small option. I didn't really frame it in a way to emphasize it, right? And so you have to navigate this very delicately, because on one hand, it's your job as the professional to know all the possibility ways possible ways that something could go wrong, the likelihood of each scenario, and then knowing when to bring those up in your education of the parent based on their values to know what information to deliver systematically and when in a way that honors both their peace of mind and their status as an informed medical decision-making adult. So once parents know the gist of all the risks, right, you've given them information on, the placenta may not be suitable for consumption if these things happen. Many parents will find that the deepest uncertainties that they have lie within themselves as they figure out what they want faced with a risk choice. People who agree about facts of a risk decision can make choices if they have different values. So one mother may really value staying in a home birth context, and another mother that may not be a value at all. So she's like, yeah, give me the GBS test, right? Just parents can have different values. So even if they agree about the facts, they can make different choices. One quote from this book, Risk, a very short introduction that I appreciated, he said, moreover, a risk that is acceptable to one person may not be acceptable to another who defines risks and benefits differently. How risk is measured depends on what we value. So for example, the book talked about a medical decision, does a 27% chance of a healthy life for one set of parents outweigh a 56% chance of death or profound impairment? Should their own well-being matter? Should that of siblings? Should the opinions and experiences of other parents weigh in? If a parent struggles with these types of questions, they don't know what they want and they're still trying to discover their values. For example, values with really medically fragile children may vary. One parent may choose not to do stem cells because their child is medically fragile or has low quality of life, and they just feel like they have no margin to take any type of a health risk with that child's health. Other parents may feel like their child is so medically fragile, they have such a low quality of life, they may just feel like they have nothing to lose. They just have their own perceptions of the world, their own values, their own way of seeing things, of where accurate medical information can come from, about who really understands their child's condition. They may have different values and understandings of hope and how their child could improve, and maybe they've really lost trust with other medical professionals who are not presenting hopeful options to their child. So every parent just has very different values that it's your job to interact with and navigate. When even a medical professional like a doctor would offer advice, parents often still have to assess the relevance, which comes back to whether we trust or don't trust those who advise us with personal medical decisions. I already talked about how decisions are framed, and studies show consistently that people respond to different ways of framing choices. So if choices are framed in terms of good outcomes rather than in bad outcomes, that really can affect someone's decision making who isn't clear on their values. For example, one thing to keep in mind is, even if a doctor offers advice, like I said, parents still have to assess the relevance of that advice. Is the doctor saying what the doctor imagines they would do if faced with the same decision in their own life? Does the doctor have the same values as they do? Or is the doctor giving advice based on what they think the parents would want to do if they fully grasped the facts of the situation? Is the doctor factoring in how well they think the parents can handle the decision in its aftermath? Are they saying what they think their employer would want them to say? Those are all considerations that parents have to grapple with when they're interacting with professional medical advice. So it's important to look at how much information parents need, because risk decisions force people to be experts, and part of your job as a placenta worker is to help mothers know the medicinal properties of the placenta and how those can benefit her in the postpartum period. It's to help parents know what their options might be for stem cells in a special needs child. People often will focus on facts and they search kind of fruitlessly for these critical facts that will tell them what to do. But oftentimes the piece that is missing is values-based, not facts-based. So your goal in risk communication is to leave a recipient adequately informed. From a decision making perspective, people are adequately informed when knowing more facts isn't what's going to change their choice. So, a good question to ask is, could I possibly learn anything more that would change my mind? And if not, then you might as well decide already. So, that's in terms of presenting facts. All decisions have the same basic elements. You have your opinions, you have your outcomes, and then the uncertainties, the things that you don't know. Will the placenta drastically affect this mother's postpartum? That's not something that you can necessarily guarantee. If a mother only has 300, a budget to help her postpartum, let's say $300 or $400, should she hire a babysitter for when she's critically in bed, or should she take that money and invest in a placental encapsulation service? One thing that you need to do for your business is to identify and organize knowledge that would be helpful in making risk decisions. So this is just another way that we're going to play with the information that you're being taught, is to take that information and to make a personal document just for your own reference about all the possible things that can go wrong, to help parents make decisions, and then to go through the material and look at all the uncertainties, right? And to have clarity on those so that you can help parents come to clarity as well when they're making decisions. Because if a parent has on a lack of clarity on their values and they have a lack of clarity on that uncertainties, right? If you can't answer their question, well, how likely is it that my placenta will become unsuitable for consumption? Like, you're giving me all these scenarios that, what if there's meconium? What if there's maternal temperature in labor? Like, what if I can't go through with the placenta encapsulation process? You have to help them to know what uncertainties there may be so that they can have some sort of clarity to start piecing together. And the crazy thing is that you're piecing together values, you're piecing together uncertainties, you're piecing together facts and information, and all of those things kind of come down to either a yes or no. One thing that's important is to not increase someone's confidence without increasing the clarity and their ability to make a sound choice. Like, you make matters worse as a professional if you're making situations seem more manageable than they really are. So what you don't want to do is come to an easy yes or an easy no, and both. Like, if a parent is coming to an easy no, that may be something that wait a minute, like, let's have a little bit more information. Sometimes a parent coming to an easy no needs a little bit of a gentle professional pushback as a parent coming to an easy yes who hasn't considered, right? Like, part of people's beef with the home birth movement, it's like, wait a minute, you got a really easy yes for that mom because she's just imagining her emotional and relational and spiritual and sexual needs being met in this context. But is she adequately informed about medical risks? Does she understand that birth involves risks of breath and of blood, and that minutes matter, and that the fact that the hospital is 7 minutes away is not an adequate framing of that risk, right? Would she like to hold her breath for 7 minutes? And by the way, it's not 7 minutes, because it's maybe 12 minutes down the stairs in excruciating labor pains because there's been placental abruption, and it's 7 minutes in the car, and then the OR team has to assemble, right, like an emergency surgery team, and that's another 27 minutes. Like, do you understand? Does she understand the medical risks of having a home birth where there isn't a medical team, there's one or two people, and there is not medical equipment, which means that even the most brilliant obstetric surgeon would not be able to get modern expected outcomes in that setting because he doesn't have a team and he doesn't have tools, right? And so even if he had adequate training, which many midwives do not have the same type of training to handle medical scenarios that a doctor would, do mothers understand that that is the choice that they're making, that they're essentially hoping that just nothing goes wrong medically while they're meeting all these other needs? So it's important that you just don't increase confidence without helping people make sound choices. And, something that the American Natural Birth Movement has done is they've been very unprofessional. They've essentially made people feel like if they talk about anything negative, that they're somehow injecting this they've shamed professionals into not being able to talk about real negative outcomes, and that's not professional. A parent deserves the right to have full explanation of the risks in an appropriate manner, and deciding as a professional how to explain those up front. If you are negativity adverse, if you are someone who's a little shy about, if you're non confrontational, you need to be aware of that tendency and to really move with skilled wisdom as a professional when you to know what risks do I communicate up front? Like, what are the upfront risk scenarios that I need to make sure parents understand? So for example, you need to make sure that mothers with placenta encapsulation understand that this is what they can expect with encapsulation, that it's not a guarantee, that they may need additional forms of support. There are multiple conditions that can arise in placenta that may mean that the placenta cannot be used. There are multiple conditions in the birth that may render the placenta unsuitable for consumption if the placenta is whisked away and sent to pathology, right? Because they need to be proactive and informed. Do you want to gauge as a professional what information might alter the parent's decision, to give them adequate upfront information, to not overwhelm them, but just to give them adequate information for an informed consent. And then you go deeper into each possible risk as they emerge as greater possibilities. And you want to make sure that if there are risks that can be averted, for example, not having the placenta taken away to pathology, you want to make sure that there is guidance and you know the risk and that you are actively, which is why in the medical community, unlike many other types of practices, the medical community actively monitors for and tests for medical conditions. It's called preventative care. It's called not letting things develop to an emergency situation, right? Whereas in lesser medically focused birth contexts, they don't screen for things that we know are common and likely to occur. And some people would say that that is not giving adequate professional medical care. But that's a subject for another time. So let's get back to here, seeking additional information. You're going to want to balance, like I said, the information that you give up front with the information that you kind of emphasize as they go through the process. And you want to make sure that you really understand the outcomes that the parents value. And defining risk oftentimes means specifying those valued outcomes clearly enough in order to make decisions about them. So make sure that you listen well to the parents. Take notes. In your conversations, don't be too quick to just pile on more and more facts, but to recognize when there is a difficulty in the decision being made because there's a difficulty in understanding their values. Sometimes parents will have different values from one another and they need some space to be able to talk that through. Sometimes the decisions that's being made is very, very personal and very exposing, very revealing. When people are wealthy and they don't have any needs, there's an incredible amount of feeling clothed and together and not exposed and not vulnerable. But when someone is poor or they're not in abundance or, they have lack, the way that we're willing to suffer and the way that we have lack is very personal. And when you have a special needs child, there are areas of lack. For example, one family that's poor might decide to have less material abundance and have the mother stay home with the children. Another family might choose to have less of a home family experience, but to have both parents work so that they can afford more therapy and medications for the child. The decisions that we make on how to be poor are very personal and very exposing, and it's easy to judge how someone else is poor. Like you might really value your health and connection to friends, and another mother might let those things go and may look overweight to you and like she's cloistered in her home, but maybe she really values um, like maybe she's homeschooling, maybe she's educating her child and she can't do everything, and maybe we just make choices on how to be poor in a different way. It's important for you to realize that these are very personal, very exposing, very vulnerable. Oftentimes people have guilt and shame around how they've chosen to make different choices. And sometimes you have to let there be a little bit of space in the conversation for pain and suffering and fear and the real issues to come out. And lastly, another quote from this book on risk. They say people tend to overestimate the extent to which their beliefs are common knowledge, and as a result, oftentimes leave too much unsaid. So you want to make sure that you give parents plenty of opportunity to say their values. They tend to overestimate how well they have conveyed their intent and oftentimes exaggerate how well others can read between the lines. They also overestimate how well others perceive the situational pressures on them and oftentimes will neglect to explain important reasons for their actions. So it's appropriate for you to ask why, because maybe if a parent makes a decision asking, can you explain a little bit more like why you came to that decision is helpful to really help parents fully explain their values, their intents, the pressures that are on them, and maybe you can help people find creative ways that you may be able to think of as a placental expert to navigate some of these areas of lack so that they can make choices that are more in line with their values. Communicating risk with numbers and words is something that was a really interesting study. When people communicate risk, they tend to prefer to use words when they are talking rather than numbers. But this leaves their beliefs really unclear because, verbal quantifiers aren't very clear. So likely may mean 40% to one person and 70% to another person. Maybe they use the word probable for the same expectation. So they would say something like the mother is not likely to get an infection that could make the placenta unsuitable. Is not likely 40% or 2%? Is not likely equal to 100% minus likely? I thought this was a really funny quote. What is not likely? Who knows? Another thing is, even if you try and use words like, where your risk is doubling, well, going from a 0.01% to a 0.02% is very different from going from 10% to 20%, right? There are very different implications there. Sometimes it just helps to look up what are a mother's chances of getting an infection in pregnancy. Just looking up the numbers so you can have the numbers, because oftentimes parents don't, they get sick of hearing likely or probable. They don't know what that means. So parents tend, when they use language, they like to communicate in words, but overwhelmingly when faced with medical decisions, parents like professionals to use numbers. So it's important for you to have a practice where if parents are asking for numbers, that you look that up for the parent. It's important as a medical professional because parents are dealing with a swirl of values and possible futures that are unclear to them. It's important that you speak firmly and plainly about negative facts and information as a professional. As a placenta professional, if you have deemed the client's placenta to be unfit for consumption, then professional standards dictate that you come to clarity on your diagnosis first before speaking with parents. And if you need to consult other practitioners, ask questions, please do so in in a way that protects client confidentiality. For example, there was one midwife, I think she was the head of the biggest midwifery publication, Midwifery Today. She got on Facebook and shared all these private medical details about her client with scenarios that you could have just looked up in any medical textbook and said, oh my gosh, yeah, if there's low amniotic fluid, that's definitely, and a racing fetal heart rate, that is definitely the sign of fetal distress. You would absolutely want to do this, this, and this, right? If you just opened any medical textbook. She asked Facebook, and then the baby dies. And she pulled Facebook as a medical professional, right? As one of the leading midwives in America. And then took down the post. Don't do that. That is not professional. Don't post a question on Facebook about a decision that you should be able to use basic medical information to make an informed professional decision. If you need to reach out to someone privately with the permission of your client, and you know what, I would say, even if that's something where it's like you're new, you think that you might have to do this, maybe ask your client up front rather than asking them after you have the placenta. Like, don't pick up a placenta, call a mom, say, do you mind if I share facts about your placenta with another practitioner? There's just some things that I'm worried about and I want to ask advice. Like, one, because she just had a baby. Two, because what do you think's going to happen? She's going to be worried, right? So maybe if you feel like if you would ever be unclear about if a placenta is safe for consumption, put that in your business clause up front. Say, I am asking for permission to share facts about the state of your placenta in case I need to ask additional expert counsel as I'm being mentored as I start my business. Like, put it up front. Don't call the mom. Um, Come to clarity about your own personal decision, right? Before you talk to the parents. It is unprofessional to burden the parents with an indecisive fact, right? Because they have less information and training that's accessible to them in their decision making process. So if they're already dealing with postpartum issues, grief about not being able to use their placenta, a lack of understanding about what their risks might be, they don't need to be burdened with unclear facts. So come to incredible clarity about the facts. Don't be unclear. So don't say, the placenta seems like it smells a little funky and I'm calling you because I don't think it's safe for consumption, but I know you really wanted to do this treatment. So what do you think we should do? Don't do that. Don't burden the parent with unclear facts. They have less training than you do. They have less professional counsel than you that's accessible to you. Instead, get on the phone with the mom, and just like I started with the how to tell a parent that their child has died, right? Practice what you're going to say. Say it clearly, say it firmly, present the facts. Say, in my professional opinion, and according to industry standards, this placenta is not safe for consumption because of X. At that point, you can inform the parents on the risks of consuming a contaminated placenta. So this would be similar to other medical procedures like VBAC, right? Something that the natural home birth movement has really pioneered is telling the medical professional community, hey, even if you think that the facts would indicate that a VBAC isn't pursued, the facts aren't all that matters because parents have different values and they're entitled to informed consent. So you might say, in my professional opinion, this placenta, according to industry standards and my professional evaluation, is not safe for consumption because of this reason. Now, I'm informing you, because I value informed consent, that if you choose to consume this placenta, that your risks would essentially involve eating a raw meat product that have signs of potential infection. So the risks that you would be taking are essentially food poisoning like symptoms. So food poisoning, throwing up, vomiting, upset stomach, nausea, diarrhea. And parents have a right to make an informed decision. And also how you frame the decision matters. If, you frame the decision like, hey, I'm required, like what a lot of natural birth movement people will do is they'll be like, I'm required to say this. But the very firm impression that they give parents is that that doesn't matter. It's just a legality. And what all the parents do, and what I really recommend, is that you ignore what I'm saying completely, sign the waiver, and do the opposite of what I'm actually telling you, so that they've covered their butts, they've covered in, liability. And what they're really pushing the parents towards with what they frame something is to do this. How you frame it matters. And it's important when you're thinking about how to frame it for you to think through all of the ramifications of that decision for the parents and make sure that they've thought through all those decisions too. Ask then how they would like to proceed and then offer services other than consumption. So I already read to you this article, How to Tell a Mother That Her Child is Dead. And, one thing that's important is be sensitive to when it's time to decide. Parents are adequately informed about the values raised by a decision when they've considered all perspectives, where every road might lead, right? That might change their choices. They should never feel the remorse if they've been professionally counseled by you as a placenta encapsulation specialist. They should never feel the remorse under your care as a Brilliant Birth Academy placenta specialist that, it never occurred to me to think about what would happen, what it would mean to live with that choice. Or had I looked beyond this, I'm sure I would have made a different choice. You want to make sure that they've seen all relevant perspectives. And that doesn't necessarily mean that they'll know which one to adopt, but part of helping parents decide is presenting all the possible outcomes and then letting them know, okay, it's time for us to make a decision now. And signaling to them, sometimes you'll have a parent where you will present information, you'll have multiple clarity calls, and they just can't decide. So you need to essentially navigate the situation of, do you need more facts? Are you not clear about what you value? Do you not know how to proceed? And you need to navigate that with professional and articulate grace and patience to be able to help parents come to a decision that is clear, that is based in facts, that's in alignment with their values, so that they can make a decision that they are comfortable with living with. And it's really important, I'll just say in closing, that you understand that the parent is the one who is living with the consequences of the choices that are made. So you never want to get to a place where you have, just be really aware when there is a risk, when there is something that someone values that is being threatened or, could be taken away. You want to really make sure that you are thinking of them more than you think of yourself. And make sure, in order to not be thinking about yourself, make sure that you're not insecure, that you don't have any conflicting values. Make sure that conflicting values of whether or not you really believe the facts that you're presenting, all of that matters in the way that you present yourself. Make sure that you have the confidence. If you don't know the answer to a question that they're asking about a fact, be humble. Always just admit, you know what, that's a really great and very reasonable question that unfortunately I have like an idea of what the answer is, but the truth is I don't actually know the answer to that question. But either I am going to find out the answer for you, or I'm going to find out the answer for you, or I think I know where to find the answer, but I'll get back to you, and make sure that you get back to them. So don't be afraid to admit if you don't know the answer to a question, and make sure too in your answering of questions that you understand what questions are being asked. Don't take questions personally or as an attack on your knowledgeability or status as, quote, an expert. Just really realize that the parents are the one who are living with this decision, and they need to be just served well, that the way that you frame things, the impressions that you give, the language that you use, and the precision of the language that you use, all of this really matters. So thank you for taking so much time to watch this presentation. Thank you for being a person that is a part of just kind of bringing the natural American birth movement up to really just higher professional medical standards of serving parents well, of presenting information in a way that is ethical and right, and for helping parents to make decisions in alignment with their deepest held values. Thank you for your attention, for being a part of that. I'll see you in the next lesson. Thanks so much.